He's got a book in the Smithsonian. Dr Joel Wallach, nominated for a Nobel Prize in Medicine, speaks at the UN, recently keynote speaker at Tesla. You know that guy, Elon Musk, sending people to Mars? Anyway, Dr Joel Wallach, our 12th week, we've had a very special guest on today, which was my dad, which is pretty cool. I'm not a healthcare professional, so please consult your own. I am a distributor with Youngevity. So for the business opportunity, please contact the person that referred this video to you. If you don't have one, contact myself. All the details are in the links. Perfect. G'day, mate.
G'day, mate.
How you going? Well,
Okay.
it's very good to see you again. This is the 12th week.
Wow.
Dr. Wallach, world-renowned naturopathic doctor, book in the Smithsonian, nominated for a Nobel Prize in Medicine. I am your host, Jamel Boukabou, 2-star executive with Youngevity International. This call is for everybody. It does not matter if you are a customer, a distributor, or you want to listen in or participate. If you do want to have a question for Dr. Wallach, please remain muted, everybody, until Q&A, and type your questions in the chat box, which I can read. And it's very important just to follow those prompts that I put in the chat box there, so I can announce you, know what your name is, your age, height, weight, health question, where you are from. That allows me to be able to give the information to Doctor. Then I can unmute. You can unmute your end and speak to Dr. Wallach personally. This is a very unique opportunity. People joining the meeting room, and now please remain muted until you ask Doc a question. And these calls are recorded, and they are all posted to the New Zealand Facebook page where anybody can listen.
Sure.
If you're not on Facebook, please contact your upline. And if you do have more questions about the business, please contact your upline. If you don't know who they are, call their head office in San Diego if you're in America, or Auckland if you're in Australia or New Zealand, and ask who your active upline is. Every customer and distributor does have an upline, and Youngevity is a direct selling company. So we are here to serve you, to help our teams grow, to share the Dr. Wallach message, and to help others and help ourselves. And I would like to introduce right now the best doctor on the planet, I think, Dr. Joel Wallach. Welcome and aloha.
Aloha, and thank you so very much. Good day to everybody. And what I want to talk about today, of course, is something universal. It's called pre-existing conditions. As people get older, you know people. Everybody knows somebody that has obesity and diabetes and high blood pressure and arthritis. They got thyroid problems. They've got a neck problem. They got a back problem. They got sciatica. They're on kidney dialysis. All the same person. They got 6, 8, 10, 12 existing conditions. Yes, boy, is your family like this? So you got bad genes? Why you have so many different things? They'll say, well, I'm 75 years old. You get older, you get all these things breaking down. No, they're all nutritional deficiencies. And it all comes down to two basic things. One, you're not getting all the nutrients necessary for your stem cells to maintain the cells of all your tissues and organs and replace ones that die, because none of your cells live forever. So they're going to be replaced. So you have to have all the nutrients necessary for the stem cells to pull off all that. That's a big responsibility for the stem cells. And then secondly, you have to be able to absorb all the supplements you're going to take to deal with these pre-existing conditions. We know, for instance, that a 3-year-old, when they get the COVID infection, their temperature might go up, their body temperature might go up a half a degree. They go from 98.6 to 99. You can't even class that as a fever. I mean, you get your body temperature up higher than that just exercising, okay? And for maybe 3 to 5 days, they'll have mild cold-like symptoms, common cold-like symptoms, and then over. They don't have any problem. Well, that's because their white blood cells are working, their antibodies are working, their stem cells are working, they got plenty of red blood cells, they got platelets and everything just working like crazy. Their intestines are happy. They're absorbing nutrients and feeding the bone marrow to make all these things that are part of your immune system. And so little kids usually don't have problems. Now there's exceptions, of course, but for the most part, little kids don't have problems. And then when you've been going, say, for 30, 40, 50 years, and you're 50 to 60 years old, 70 years old, 80 years old, you've been eating gluten for 60, 70, 80 years, all those villi don't like gluten, so they shrink and go away. So now you have a smooth intestine instead of a intestine that's kind of like a shag rug. And in a smooth intestine, you're only going to absorb 0.5% what you take in. Now you can absorb calories because they're small and easily absorbed. But what about all the nutrients? They're big and bulky and complicated and very difficult to absorb. So without all those villi to increase surface area by 98%, you're in trouble. And that's why people over time, they get all these pre-existing conditions. Now, we've known about these things. This is nothing new. We've known about pre-existing conditions for hundreds of years. We've known that. But what people didn't know was it's happening slowly over time in a drip, drip, drip thing, because even if you're supplementing, you're not able to get everything you need because you can't absorb it. Now, when you look around the world, there are places where people live a long time. 200 years, 260 years, 180 years, 160, 170. And they get their birthday announcements in the newspapers all over the world, and people just say, oh, well, there's nothing we can do about that. But why is it? Well, it's because they get something we don't get. There are 90 essential nutrients that all vertebrates, whether you're a whale or an elephant or a human being or a hummingbird or a snake, a wombat, a kangaroo or a wallaby, a human being, ostriches, gorillas, horses, cows, sheep, all vertebrates require 90 essential nutrients to perform all these biological things for maintenance and repair and longevity, and also having healthy babies. And when you don't have these nutrients, those things, the efficiency begins to go down, you start having problems. So one of the research projects I did was look at the top 10 countries that live the longest. Okay, nutritional minerals do not occur in a uniform blank around the crust of the earth, no more than gold and silver and coal and oil. They all occur in places. It might be a gold mine, might be 10,000 miles apart. Same way with all these nutrients that are necessary to live a long, healthful life. So what's the only way you can guarantee you're going to get all these nutrients every day like you need is to supplement with them. Now, remember, I'm a veterinarian as well as a physician. And in veterinary medicine, we've been giving nutritional supplements, vitamins, and minerals to animals for hundreds of years. Hundreds of years. I mean, people knew. Why is it that they would go hunting around all the salt licks around the world? The salt and all the deer and the antelope and all these wild animals would go there to get the salt, and you just had to sit there and they came, you'd shoot them with your bow and arrow or spear them or trap them or whatever it was. And now they use, guns to kill them. But the attraction of salt is heavy and big with all vertebrates. Now, salt is a very useful thing. Of course, medical doctors tell you to avoid salt because it causes high blood pressure. That's nonsense. Doctors who tell you to avoid salt should be put in jail. Sodium chloride is an essential nutrient. You cannot digest food without salt to make hydrochloric acid. Sodium chloride is made into hydrochloric acid so you can digest proteins and absorb minerals. If your stomach and intestinal environment is neutral or alkaline, you cannot absorb nutrients. Your stomach has to be like battery acid, and then you don't get bacterial growth in there because it's sterile. Now you start taking all this stuff to alkalize your diet and alkalize your food and alkalize this and take baking soda because you got gas or something. What happens is you neutralize your stomach environment, or in the worst case scenario, you alkalize it and bacteria begin to grow there and they ferment the food and cause gas. And the doctor says, you have acid reflux. I'm going to give you more alkalines to get the acid thing up to, it needs to be neutral and alkaline. And then the bacteria grow and flourish and you're belching and burping and bloating. He says, oh, you have acid reflux, so I have to give you Nexium and all these drugs to deal with that. And then the drugs kill you. But, he got enough money to send his kids to college, so he's happy. Okay. I have to appreciate, and I know we're talking to people all over the world, to Australia, New Zealand, the Philippines, and so forth, but the principle will be the same. And Johns Hopkins, one of our famous medical schools in Baltimore, Maryland, did a 7-year study. They did a 7-year study from 2013 till just about 4 or 5 weeks ago. They looked at the top 8 killers of patients in American hospitals each year. Number 1 was heart disease. Number 2 was cancer. And I don't believe that because, you know, did people get a heart attack and they go to the hospital and there are all these millions of people dying? No. It was complications of the treatment that killed them for heart disease. In the same way with cancer. Oh, did they get cancer diagnosed in the doctor's office? They go running to the hospital and they all died when they walked in the door? No. Okay, they died from complications of treatments, infection following surgeries, chemotherapy and radiation, all this kind of stuff, killed their bone marrow, killed the patient, and so on. So number 3, though, was the one that I liked. And the top 8 killers of Americans in hospitals each year, number 3 was medical errors. Now, this is Johns Hopkins, one of the most highly regarded medical schools in America, in Baltimore, Maryland. They said the number 3 cause of death in American hospitals each year is medical errors. They said each year, medical doctors kill, that's the words they use, kill, in hospitals, in their workplace, in America, they kill 251,000 to 440,000 people. Now, you tell me, how many businesses could stay in business in Australia or New Zealand or Hawaii or mainland America or Europe if they kill 251,000 to 440,000 of their customers in their workplace every year? They'd be out of business in 3 seconds. They'd shut them down, everybody go to jail. But the doctors get a walk. Okay, because there's insurance there. I don't care if you kill me, I don't have to pay for it because insurance pays. I don't care if you don't get rid of my disease, as long as you get the pain away, insurance will pay. The only medical approach that cures a disease is antibiotics. Will kill staphylococcus, streptococcus, salmonella, E. coli infections, that kind of stuff. Otherwise, all other treatments other than antibiotics are designed to relieve symptoms, so you'll be happy. Cortisone, prednisone, aspirin, those kind of things. Oh man, I take 2 aspirin and all that cortisone. Man, my skin psoriasis used to kill me. I couldn't sleep at night. It was so painful. Man, they give me a cortisone shot every month and I take my aspirin every day. I'm good to go. But it's a nutritional deficiency. You're not absorbing nutrients. And so 2 years from then, you're going to get a double knee replacement at $50,000 per knee. That's $100,000 the doctor just made there in an hour's worth of work. Because he drug you along and you're happy. You love that doctor because he gave you 2 years pain-free with prednisone and aspirin. Okay, so that's why we came up with this book. It was my first book outside of the academic books I had written, you know, at university. This one, Let's Play Doctor. And Let's Play Doctor teaches you how to make your own diagnoses. You don't have to go to a doctor to get diagnosed for diabetes. You think, you know, we got diabetes in my family. I'm 50 years old and I'm urinating a lot. Maybe I have diabetes. You go to a pharmacy without a prescription, you get the test strips, are $1.50 each. Pee on the strip and hold up the bottle, says you got diabetes. Costs you $1.50. You don't have to pay $100 for an office fee. You don't have to pay $200 for the chemistries. And the doctor didn't have a chance to kill you. And it only costs you $1.50. I mean, that's a heck of a deal when you think about it. So basically, for less than the cost of a cup of coffee each day, you can add 25 to 50 healthy years to your life, okay, by doing your own diagnoses. I mean, obviously, you get run over by a truck and you're bleeding internally, you got to go to the emergency room. But when you read this book, it tells you all the things that these long-lived cultures do. Now, the interesting thing about the stories in here, let's say the family separates and half go to England and half go to Australia and the others stay in Pakistan. Well, the ones that stay in Pakistan live to be 165. Their brothers and sisters and their kids who moved to Australia, they died at 50. They lost 110 years by moving to Australia because they didn't supplement. Well, mom and dad didn't supplement and they lived to be 165. That's because they're getting all these nutrients because those nutrients are there, not in Australia. I guarantee you, for the livestock and the cattle and sheep and horses and goats and things like that in Australia, they're giving them vitamins and minerals. They don't want a veterinary bill, so they give them vitamins and minerals to prevent all these health problems. Your doctor says, oh, just eat well, you get everything you need. Don't waste your money on those vitamins and minerals, just eat well, you get everything you need. Bam, you're dead. So we have to kind of take control. And that's what these books do. They give you information. You can make choices. And of course, we have 15 of these books. The most recent one is Epigenetics. My thesis for my postdoctoral fellowship, which is kind of like a PhD degree, is in the Smithsonian Institute as a national treasure. Okay, I did 20,000 autopsies on a $25 million grant from NIH. And all the information's in here, okay, in this book. And I think it costs $25 US or something like that. Epigenetics. Me, along with Bruce Lipton, okay, the two of us are considered the fathers of the science of epigenetics, which has replaced genetics. The reason why my thesis is in the Smithsonian Institute as a national treasure, I showed there were no genetically transmitted diseases. There are no genetically transmitted birth defects. It was all a false theory because doctors didn't know the causes of things. So instead of saying, hell, we have no earthly idea what's going on here, we got to do some research before I can give you an answer. I can give you some drugs to relieve some of the symptoms, but I can't prevent it or cure it because I don't know the cause. But they never did that. They say, oh, you have a genetic disease here, take this. I can't cure it because it's a genetic disease in your family, but I can relieve your symptoms. So they're blaming it on you so they don't have to work too hard to try and figure out what's going on. Well, now what I want people to do is two things. Number one, give up all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, butter, oats, and no sugar. And you say, well, that's everything I eat. What do you mean I have to give it up? Well, what I want you to do is eat like an Asian. Let's compare two cultures here. Let's compare two cultures. Let's look at Australia, okay, Australia. And Australia, so far this year, has 27,484 COVID infections and 905 deaths. Let's see here. New Zealand has 1,900 infections and 25 deaths. You look at Thailand, has 3,727 infections and 59 deaths. Japan has 95,000 infections and 1,600 deaths. And then let's look at the UK, 810,000, almost 1 million infections and 42,000 deaths. Canada, your fellow country, has 209,000 infections and 9,800 deaths. The USA has 8,411,000 infections and 223,000 deaths. So what's the difference between the USA with 223, almost 250,000 deaths, versus New Zealand, okay, with 25 deaths? And what about Mexico? Has 874,000 deaths and 874,000 infections and 10% or deaths, 87,000 deaths. Mexico has an extremely high rate of deaths. And the reason is how they eat. They live on everything is wheat, barley, rye, and oats. Whereas these Asian countries like Thailand with 59 deaths, okay, they live on sweet potatoes and rice. Japan has 1,600 deaths. They live on sweet potatoes and rice. Mexico with 87,000 deaths, almost 100,000 deaths. They live on wheat, barley, rye, and oats. And their cerveza, their beer, their pan, their bread, okay, noodles, flour tortillas, okay. And so everything they eat is wheat, barley, rye, and oats. Whereas the rice-eating countries do very well. I'll give you one more. And that is India. India has 1.4 billion people. 1.4 billion people, about the same number that China has. Now, China has 4,000 deaths with 1.4 billion people. What? Yeah, they only have 4,000 deaths. Now, India has 117,000 deaths. Okay? Like 25 times the death rate of China. What's going on there? Well, India has two separate parts. The northern 1/3 of India, which has 10 of their 29 states, have 95% of the deaths and 86% of the infections. They eat entirely wheat. 2/3 of India, in the southern 2/3 of India, they have 5% of the deaths and 14% of the infections, and they live entirely on rice. They're all the same peoples all over the entire country of India, but they eat differently. because up in the mountains, they can't grow rice, they can grow wheat, but down in the swamps, they can grow rice. Okay. And so all this data came from the World Health Organization. I contacted them and I wanted to know, were there any differences in the 29 different states of India, the rate of infection and deaths from COVID? And they sent me this email with all this stuff in it. Very obvious what's going on here. So if everybody gives up wheat, barley, rye, and oats and starts eating rice and sweet potatoes and vegetables like the Asians do, and you can do that, let's say you eat rice and sweet potatoes and vegetables Monday, Wednesday, Friday, and on Tuesdays and Thursday, you eat the typical historical Australian and New Zealand and British foods, wheat, barley, rye, and oats, the odds are you're going to get better taking your 90 essential nutrients. Okay. But personally, I'm the kind of guy who said, okay, for a year, I'm going to give up wheat, barley, rye, and oats. I'm not going to do that. I'm going to eat rice and sweet potatoes, which I do. I have rice and sweet potatoes for breakfast and dinner as my main food. I eat salmon. I eat lamb chops. I eat beef. I have wheat, barley, excuse me, I have not wheat. I have rice and sweet potatoes. I'll have tomatoes and eggs. I'll eat 3 eggs twice a day, soft boiled with soft yolks, or soft poached with soft yolks, or soft scrambled butter. No frying, none of that kind of stuff. And I'm 82 years old in a couple of months. Right now, I'm 81 years old. I've been taking the supplements and eating gluten-free for 72 years. Most people think I'm in my 50s when they look at my energy levels and my memory and so forth. And, you know, I don't have anything with I don't take any pharmaceuticals, no medications, no painkillers. I don't take any prednisone, cortisone, but I do take my 90 essential nutrients, what I've been doing twice a day for 72 years. Okay, so it makes all the difference in the world. I only weigh 142 pounds, but I take the dosage rate for a 200-pound man. Okay, I figure that little extra is good insurance. That way, and I avoid all the bad stuff. No wheat, barley, rye, and oats, so my absorption is almost 100%, and I'm getting all the benefits of everything I'm taking. And of course, we have our sports drink Rebound, which has 100 nutrients in it. Okay, Red Bull and Gatorade has 2 or 3 nutrients, and it's mostly sugar and caffeine. It's energy. They're energy drinks. They're not really meant to be a nutritional drink. Our Rebound has 100 nutrients in it, 78 of which are minerals. So I drink 3 of those a day. Okay, and they're cans. They come. You can get them in 12-ounce cans, or you can get the little pouches, 30 in a box, or you can get a canister where you can make a big 5-gallon thing for a team. You know, with this little half or quart pint canister full of the powder. And, you know, kind of pay attention to what you're doing and just don't kind of eat without thinking about what you're taking in. Read labels. Don't fill your pantry at home with things that have gluten in them. Well, it doesn't say on the label. Yeah, it does. Look at the fine print here. Other ingredients. Oh, wheat bran, rolled oats. You see, but it doesn't say it on the front of the label, but it doesn't say gluten-free. If it doesn't say gluten-free, you better look at every word on that label. Okay, and protect yourself and the people you love. You'll add 25 to 50 healthy years to your life. You will save an enormous amount of unnecessary misery. You'll save an enormous amount of money just by doing all that stuff. Remember, we have what we call secret sauces for diabetes and high blood pressure and kidney failure and dialysis and heart disease of all kinds, plugged arteries, osteoporosis, arthritis, thyroid issues. Let's see, Alzheimer's disease. There's 10 different dementias. I always treat for all 10. That's why I'm very successful at resolving dementias, because I treat for all 10. There's no law that says you can't have 3 or 5 or 8 or all 10. So I always treat for all 10. I don't just treat for Alzheimer's disease, which is the diagnosis that the doctors gave. Well, why did the doctors give a diagnosis of Alzheimer's disease without testing? Well, he has responsibility if he tests. If it shows you got 3 of those other diseases and not Alzheimer's disease, he's going to lose a lot of money, because insurance companies pay the most for treating Alzheimer's. But there's no rule that says you can't have 1 or 3 or 5 or all 8 or 10 different dementias at the same time. So I always treat for all 10. And that's where this comes in, okay? Goes into 600 different diseases. Epigenetics, the death genetic theory of disease transmission. If you have 2 of the most common pre-existing conditions, obesity and diabetes, you want to get this book, okay? Hell's Kitchen. Goes into, obesity, diabetes, and the metabolic syndrome, which deals with all these other issues, which increase your risk of getting serious complications and even death from COVID. So, and in of themselves can kill you. You don't have to wait to get killed by COVID. If you have all these pre-existing conditions, many of them will kill you, or the doctor will kill you treating you for those things. Okay? So, one other thing I want to throw in here, and that is to carry this on, and I just cannot thank our team in Australia, New Zealand, and the Philippines, and everybody there in the Pacific. I just am so excited about everything everybody does, and just appreciate it. That when it comes to birthday presents, graduation presents, okay, we're talking about presents for anniversaries. You know, you've been married 25 years, but both of you have high blood pressure and diabetes. Well, I'm going to give you this book. I'm going to pay for your first 3 months of the supplement program. I'm going to put you on auto ship. Okay. And I'm going to give you 3 months of that for your obesity and your diabetes. And we'll get you going here because I want another 25 years from you. Okay. And so you do that instead of giving them a bottle of champagne, you give them something that's going to add 25 to 50 healthful years to life. And you have a system and you teach them the system. And of course, we have 110 CDs. We have 50 something DVDs. And of course, the newest CDs are a set of CDs, epigenetics. They just came out. They're available now. They're being shipped all over the world as we speak. It goes along with epigenetics, the death, the genetic theory, disease transmission. For the 50 years that I've been doing this, there's 25 major stories where I've saved millions of people just by inventing the secret sauce for that disease. Okay. And it's one of those things where here we go. So anyway, we have all these secret sauces for these diseases. We're saving in this particular thing 250 people. This next one, we saved every bear in the world. The next one, we brought sight back to 30 people who were blind for 6, 8, 10 years. Another one, we have all these people who are dying of heart disease, and we figured out what the cause of the heart disease was. Okay. And so, again, what we want to do is look at what's called here the Wallach corpus. Wallach corpus, C-O-R-P-U-S, that's Latin for body. It could be a body of evidence, a body of information, as well as your body, right? The Wallach corpus. And it was actually taken after the oath, the Hippocratic oath. Hippocrates came out with the first corpus, was called the Hippocratic corpus in 400 to 500 BC. There were 60 papers he wrote because there were no medical schools back then. And there was just witches and healers and grandmas. There was no doctors as we know them. So he wrote 59 papers on diseases he knew the cause and cure of. And his 60th paper was the Hippocratic oath. And the Hippocratic oath was, you must swear on your life and the life of your kids that you will not tell anybody what I teach you. You will not tell anybody what I teach you. You cannot tell them what the cause and prevention and cure of this disease is. If you find somebody in your family or your workplace with this disease, you send them to me. That was the Hippocratic oath. Well, now every doctor in the world takes that Hippocratic oath when they graduate medical school. Okay. 3,000 years later, they're still taking that Hippocratic oath to protect their profession and the income stream to the profession. Okay. Well, the Wallach corpus, okay, is a 2 CD set with these 23, 25 different diseases, major diseases, heart disease, cancer, arthritis, Alzheimer's disease, these kinds of things, all the big ones. Tells you how to diagnose them, what to do. And again, you don't have to be a doctor to diagnose diabetes. You don't have to be a doctor to diagnose high blood pressure. You don't have to be a doctor to diagnose Alzheimer's disease. You don't need to be a doctor to diagnose arthritis. These things teach you how to do this. and you will add 25 to 50 healthful years or more to the life of your families, your friends, your workmates. And so I really, really appreciate the opportunity to share with you. I consider Australia my family. I spent 20 years in the Air Force. I spent a lot of time in Australia and New Zealand through the Air Force. So I consider myself a Kiwi, one of you guys. Over to you.
Thanks, Dr. Wallach. Well, my grandfather was a Kiwi, so I'll take that as a compliment as well. Okay, well, look, this is week 12, everybody. And these calls are recorded. I know I said this at the top of the call, but this is super important. If you want to get the training tools, you get them from Dr. Wallach's store, drjwallach.com. If you're in Australia or New Zealand, you need to call the number on that website. Call during business hours, Pacific time. Get your Dead Doctors Don't Lie CDs. I prefer the best of with Q&A. You can get your ID number and your phone number and your email printed on the CDs. I get them in lots of 100. They send them to you, and I would always order 1 or 2 books along with that. I can't tell you how many people I bought 2 copies of Epigenetics, and I haven't got any copies on me at the moment because when you lend them, you need to ask for them back because they're so important. But
I won't give them back unless you ask.
That's correct. And one of my uplines is one of the most successful in the industry. Sandy Ellsberg trained me earlier. She said, when you are sampling with your CDs and your Dr. Wallach books, you need to say, I need these back, because they are very, very important and valuable. And that's how we grow our business. So I'm hosting a call on Mondays for everybody. Doesn't matter who team you in, 2 p.m. Sydney time. And that is a business call. So we're separating these calls. This is Dr. Wallach only. I just needed to make that absolutely clear. And also these calls are recorded and uploaded to the Facebook page. I know I said this at the top, but if you don't have Facebook, please contact your upline. They can get that recording to you. Okay, we are going to go to calls now. Please keep your chat box open, and please just give me all the information that I'm typing in the chat box that Dr. Wallach needs. That makes it easy for everybody to follow along as well. And it helps me address the caller and take the question. So we are going to go now to Vivian. Vivian, if you want to unmute yourself, let us know where you're from, ask Dr. Wallach your question, and we will hopefully get through all callers today. And no need to ask the question more than once because these calls are recorded. Go ahead, Vivian. You can unmute yourself right now.
Yeah, thank you. Vivian, I'm from Christchurch, New Zealand, Doc. I have a customer who is 66 years old. He's 5'10", 175 pounds, and he had a near-death medical misadventure and wound up with a temporal lobe brain trauma with loss of cognitive functioning and hearing. And the only other information he's been able to give me is ECSRI and Larium.
Okay.
I don't know what that is, but he would really like some good help.
Sure. Okay, you say he weighs 100 and what?
175 pounds.
Okay. So what he needs to do is get rid of all the bad foods so he can maximize absorption. So he's going to get the maximum for what I'm going to recommend for him. Absolutely no fried foods, no processed meats, no oils of any kind, and no, gluten, no wheat, no barley, rye, and oats. Have to live like an Asian, rice and sweet potatoes and vegetables. And then, of course, no sugar. And then at his body weight, I want him to have 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Take a full dose of everything twice a day.
Yeah.
And because he was this from head trauma, or did he just have a ruptured aneurysm, or was it surgery, or?
I don't know. The only thing he's given me is ECSRI and Larium, so I don't know what that actually means.
Oh, Valerium is a kind of a tranquilizer.
Okay.
Valerium is a tranquilizer. Okay.
He can't come
so anyway,
fall, so.
Might have been a fall.
Yeah, I'm not quite sure.
Yeah. Okay, we can check later. But at any rate, it needs to get rid of all the bad foods, maximize absorption, 2 healthy brain and heart packs per month. I want him to get the HGH. I want him to get 2 bottles of our HGH so he can take 5 of those capsules twice a day. And they're designed to deal with the central part of the brain function and biochemical talks to each other, and also the pituitary gland. I also want him to get 2 bottles of our synaptive, which is the raw materials for every brain cell to make the biochemical that's necessary for the cells to talk to each other. Okay, so I'm going to get 2 of those bottles. We can take 3 of those twice a day. It's called synaptive, like the synapse, brain function. Then I want him to have the de-stress capsules, 3 of those twice a day. That's 2 bottles a month. I also want him to get the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. That'll support healthy blood pressure, but also help healthy blood flow through blocked arteries in case he's got blood clots in those areas of the brains. And of course, if we get more information, we might change things around a little bit, but this is a good place to start. I deal with these kind of things literally thousands of times a month. In this program, you're going to see benefit within weeks, and certainly within 90 days, you're going to get maximum benefit. You'll see what you're going to get by then, usually, if he's really been good about getting rid of all the bad stuff, maximize absorption.
Okay. That's great. Thank you.
Okay.
Yeah.
Thank you. Let us hear how he does, and certainly any questions. And
I will. Thank you. That was my cell phone going off in the background.
Okay. Thank you.
Yeah. Sounds like a kid playing with his dog.
Yeah. It says, let me out. I'm stuck in your pocket.
Thank you very much. Okay, we're going to Ashlyn now. Ashlyn's actually in Hawaii, so she's asked me to ask a question. Aloha to Ashlyn there, and Ashlyn did see Dr. Wallach a few years ago in Hawaii. Ashlyn has a son, 43 years old, 180 pounds, 5'9", and has arthritis all throughout his body. What would be the protocol there, Dr. Wallach?
Okay, that's very exciting. Okay, 180 pounds of arthritis. He needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, wheat, butter, I know it's got to go. Absolutely no cross-contamination by anybody in the household, dog, cat, bird, fish, it's all got to go. And then I want to eat like an Asian, rice, sweet potatoes and vegetables, fish, poultry, red meat's fine, but nothing fried, nothing burnt. And then at 180 pounds, I want him to have 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Because this is not just like simple arthritis of the knee. She says he's got arthritis all over. Okay. So he's got some serious issues. And I'm sure arthritis is just the thing that's up here that bothers him all the time, but he's got other issues. Does he have high blood pressure? Does he have diabetes? Does he have kidney issues? Does he have thyroid issues? So that's why the 2 healthy brain and heart packs per month. And I also want him to have our MSM. I want to have 9 of those tablets a day, 3 with each meal. That's 2 bottles a month. And they're designed to support the body's ability to remake and manufacture cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself, skin, artery walls, and all that kind of stuff. So 3 times a day, that's 2 bottles a month of our MSM. He needs a vitamin D3 capsules. I'm going to take 3 of those twice a day. That's 2 bottles a month, so he can absorb minerals, particularly calcium, and put them in the right places. And then he also needs the collagen. And we have 2 types of collagen. I use both myself. I only weigh 142 pounds, but I take 2 servings a day of the glucogel, which is a beef collagen. Okay, I take 5 of those capsules twice a day. And then for lunch, I use the powder of the collagen peptide, which is a mixture of fish, poultry, sheep, and beef collagens. So I take a serving of that at lunchtime. And again, I'm 82 years old, and I don't have anything going on with any of my bones and joints and cartilage and ligaments and tendons because I've been doing this twice a day for 72 years. Okay, and so most people think I'm in my 50s when they look at my energy and listen to my voice and they see me and so forth. Don't see the wrinkles and white hair and so forth. So they think I'm 50 years old. I don't have any of these pre-existing conditions. I don't have high blood pressure and diabetes and arthritis, and I don't have things like thyroid issues and kidney failure and those kinds of things. So that's kind of where I would go with this guy. We do have pain relievers. We do have our CM cream. which you have to mix up if it sits on the shelf for a couple of days, because the cream will settle and the water comes to the top. So you do have to take a straw or a toothpick or something and kind of make it homogeneous before you take a dose of it. So you want to take our CM cream, and we have our trauma oil, which is a mixture of aromatherapy oils. Put 5 drops of the trauma oil and say a teaspoon of the CM cream, and he could apply this to the joints on his body that hurt the worst: his knees, his shoulders, his hips, his elbows, his neck, wherever. But also, we have another one, our Soothe from our Hemp FX. I think we're able to ship that to Australia. There's no THC in it. It's a CBD oil. Can you guys get CBD oil there in Australia? I think so. New Zealand?
We don't have it at the moment, I don't think, but Dracy is on the call. If you want to unmute yourself and fill us in, go ahead, Dracy. I do know we can get trauma oil.
Okay.
Yep.
Okay, so let's,
I'm here. Sorry about that. We cannot bring it down into Australia, New Zealand at this current moment, but we have big fingers crossed that come March, some laws will be passed down under, and we will be able to have it past March. So we're hoping.
Okay, but right now we do have the CM cream and trauma oil, correct?
Yeah.
Okay.
Trauma oil and physical care.
Yeah.
Okay.
There you go. Some trauma oil. Yep.
So you can apply those to any place that hurts and get a couple hours of relief. And I like to put it, have people put it on before they go to bed at night, so they can get a couple extra hours of sleep instead of getting 4 hours before the pain wakes them up. They can get maybe 6 or 8 hours before they have to get up in the morning and so forth. And the body has an enormous capacity to heal itself if you give the body all the nutrients and you get rid of all the bad stuff to maximize absorption. You're responsible for 2 things. Number one, you have to take all the nutrients, and then also you have to take and eliminate the bad stuff so you can maximize absorption. Then you're going to get maximum benefit. Back to you.
Thank you very much, Dr. Wallach. We're going to go to Trish in Auckland. She's got a question about a dog. Go ahead, Trish.
Hi, Dr. Wallach. I have a little dog who's Pomeranian Shih Tzu. Here she is here. She's about 6.5 pounds, and she's 15 years old, and she, in the last 3 years, developed an enlarged heart. I've had her on the Arthritis all this time, and there's been a really good improvement. But lately, she started to develop a really hacking cough.
Okay. Well, there's 2 things you need to add to the Arthritis. And you say she weighs 15 pounds?
No, she weighs about 6.5. She's only little.
Oh, okay.
Yeah.
Okay. Yeah. So the Arthritis, I would give her kind of a half a scoop of the Arthritis in her food. I would also give her 2 of the EFA capsules, or 1 EFA and 1 EFA pluses. She needs those soft gel capsules with the omega-3s in there. But then also, I would have her take the de-stress capsules. Okay. I want her to have 2 of those a day. So that bottle's going to last 3 months of the de-stress capsules.
So
Congestive heart.
We don't have those here. So what alternative?
Yeah. Okay. Well, the alternative would be, say, our selenium. You do have our selenium there, right? Okay.
Yes.
And so I would give her, start her out with 1 of those capsules, open up and dump it in her food, 1 capsule of our selenium. Our selenium is different. It has 4 different things added to it. Okay. These things are things that get rid of special diseases like artery wall damage, tendon and ligament problems, and also osteoporosis of the skull. Okay. And so because when you have osteoporosis of the skull, it can squeeze the 10th cranial nerve, the vagus nerve, which causes a coughing thing, kind of like a dry cough, COPD in humans kind of thing. Okay, so that's a possibility there. Yeah. And so I would go with 1 of our MSM tablets, grind it up and put it in the dog food, or just open it mouth and plop it down there and rub the little throat, or MSM, 1 of those. And a couple of glucogel, deal with osteoporosis of the skull, because I'm going without ultrasounds and all the other stuff that I would do. And so I'm kind of trying to cover all the bases there. But I think this is something that is reversible, and you can add several healthful years to that puppy's life. Okay.
Thank you.
Thank you very much. Now I've got a very, very, very special guest, Dr. Wallach, my father.
All right.
So there you go. Now I'm going to let my dad. So what's going on, Dad? What's happening?
No, I tear a muscle and arthritis. I can stand up properly. All around.
Okay, I heard arthritis in a torn muscle.
Yeah.
And he's got gout as well.
Okay, got gout.
Well, he said he doesn't know.
Okay, what does he weigh?
72.
72 kilos.
Okay, so maybe 160 pounds kind of thing.
He's a bit short than me as well. How tall are you?
173.
173 centimeters.
Okay, so basically what I want you to do is give up all the bad foods so you can maximize absorption. And you have a good food, bad food list. Give Dad a good food, bad food list. No fried foods, no processed meats, no oils of any kind, no gluten, no wheat, butter, rye, oats. Live like an Asian. Again, rice, sweet potatoes, vegetables. And then I want him to have, and you say he weighs what, 160, we said, something like that?
172.
172 pounds. Okay. Yeah, 172 pounds.
72 kilos. And how old are you, Dad?
75.
75.
Okay. So 150, 160 pounds. I want him to have 2 of those healthy brain and heart packs per month. 2 healthy brain and heart packs per month. I want him to take the MSM. I'm going to take 3 of those twice a day. That'll be 1 bottle a month to help rebuild cartilage and ligaments and tendons and connective tissue and so forth. And that's going to help with the torn muscles. That's going to help with the, again, connective tissue and the ligaments and tendons and cartilage and the bone matrix and bone itself. And let's see here. He had the arthritis and he had, what else? I apologize.
May have gout, but he's not sure.
Oh, gout. Yeah. Okay, so gout. Well, that's easy. When you have gout, you have to get rid of the uric acid stuff, okay? Which means shellfish is the main thing you got to get rid of. Shrimp, things like lobster, crab, things like oysters and clams and all the seafood you got to get rid of, okay? And so you get rid of that stuff because they have uric acid in there. So you have to get rid of the uric acid, and it would also include organ meats. You cannot have liver or heart or kidneys, and he cannot have beans, okay, because they all have this uric acid in them. All those things, I had to stay away from those forever. And then again, he can use the CM cream and the trauma oil to relieve pain in his joints and so forth. But the body has an enormous capacity to rebuild joints, cartilage, ligaments, tendons, connective tissue, bones. And the body has an enormous ability to do that. And so you just get rid of the bad stuff, maximize absorption, take these nutrients, and the body will actually rebuild. And so I want to hear from your dad, like every 2 weeks or so, and give us have him give us a testimony, because he's going to have a great story.
He's got a good associate to do some follow-up.
Yeah.
Thank you, Dr. Wallach, and thanks for talking, and thank you, Dad.
Thank you.
Thank you. There you go. There's my father. And it was great having Dr. Wallach stay at my home when I was in Hawaii. Mm-hmm. And Steve is Dr. Wallach's son, and Steve is the head of operations there in San Diego. So there you go. We are.
Yeah, he's my boss.
There you go. Well, I say the same thing to my father when he's not in the room. He's just left. But anyway, let's go to the next caller. Thank you very much. That's what makes this so special. I would not be able to get a world-class doctor to give a protocol like that. So
thank you.
Thank you very much. Now we are moving on to the next caller, and there you go. You only need to ask the question once, and that's why it's so good to have your associate in the room with you on the call, because Dr. Wallach's talking and we're understanding everything that he's saying, so we can go and do the follow-up in the protocol. So that's our job as a distributor. Even as a customer, if you want to help the person get on the Dr. Wallach protocol. And bear in mind, I'm not a doctor, I'm a distributor. So I always say on these calls, contact your healthcare professional, because I'm not one. I am a Youngevity distributor. Dr. Wallach is the doctor, another thing that my great upline, Sandy Ellsberg, has trained me very well in. Okay, we are going to go to the next caller. And we've got about 14 minutes. I try to get to everybody. Please put your comments in the chat box with all that information. And I've just got a question from Doug. where can we get the recordings from last week's session? They are all on the New Zealand Facebook official website. So go there. If you can't find them, scroll until you find them. Dracy is on the call. The reason why last week's call was a bit later to upload was there was a caller on that didn't want their part public. So I had to go and edit that out. So please bear in mind, this call is for everybody to listen to and will be uploaded. This is how we get things done. Look, my dad's protocol is going to be uploaded. It's my father. So, and this is so we can make this go to the whole world and help everybody. Okay, let's go to the next caller. And that would be Michael Neville from Melbourne. Unmute yourself and give us your question. Go ahead, Michael. Oh, you need to hit the unmute button there, Michael.
Okay. Hi, Joel.
Yes, sir.
Two questions. One, gluten-free bread, and the other thing is I've got curvature at the back of the neck.
Okay. Now there are gluten-free breads that are made from rice flour and buckwheat flour, and those are fine. They're gluten-free, guaranteed gluten-free. Now you have to watch some of them because they'll say gluten-free, but they've got oats in there, and they think, oh, there's gluten-free oats. There are no such things as gluten-free oats. The gluten in oats is called gliadin, and so when you look at it, there's no gluten, but it says gliadin. Okay, you can't have any bread with any oats in it. If you want to eat, rice crackers and rice bread, that's fine. I like to. When I have pizza, I call ahead and they say, look, I'm bringing a whole bunch of people over there that have a gluten problem. They will die before they walk out of your place if you screw up and you give them a regular pizza crust. We want all the pizza crust to be gluten-free, got to be made out of cauliflower or rice, or cauliflower and rice, okay? And you got to guarantee us when we walk in that that's what we're going to get. And, we give them our name and numbers and everything, and they do it, and they do a wonderful job. And so you can still go out and eat pizza, but they will put you off in a corner where you have space between you and other people, and they give you the gluten-free pizza, and you ask them, do you have two ovens or one? We have one oven. Don't go there because they're putting your gluten-free pizza in the oven with the regular, and the regular pizzas are spitting out the gluten and popping and cracking, as if they have an oven just for the gluten-free pizza crust only. That's good. Okay, so those are the ones you want to frequent. And so I hope that helps you a little bit for that question.
The other one was the curvature of the back of the neck. You know that hump?
Mm-hmm.
What's that all about?
Is it going out or is it going in?
It's out.
Okay, so it's a bulge. Okay.
Yeah.
Yeah. And so what's happening is your muscles are pulling on weak ligaments and tendons and disc and all that kind of stuff, and so you get an anatomical aberration there because everything's not tight enough to hold things into place, and just simple muscle pulls are changing the structure. And so is this you or somebody else?
That's me. I also get a little bit of a sore shoulder muscle on both sides from, I think, the same thing. Yeah.
Okay. How much do you weigh?
170 pounds, 5'11", 71.
Okay. Now, do you have any ring in your ear? Do you have a tone in your ear, kind of like that tinnitus noise?
Yes.
Okay.
Definitely.
Do you ever have any balance problems or dizziness?
Actually, the last couple of years, I've noticed something very slight. Yeah.
Okay. Now, also, let's see here. Do you have any numbness or tingling in your fingers or any carpal tunnel syndrome in your wrists?
No.
Okay, so your stuff in your arms is all closer to the shoulders and the neck and stuff?
Yes.
Okay, yeah. You have osteoporosis of the skull is your problem.
Right.
So now people don't realize you don't only get osteoporosis of your pelvis and your lower back, you get osteoporosis of your skull. Now, there's 25 different diseases you can get when you have osteoporosis of the skull. Oh, here it is. I'm looking for all this papers. Okay. It's called It's All in Your Head. This book covers the 25 different diseases you get from osteoporosis of the skull. The one you got, okay, you're squeezing the auditory branch of the 8th cranial nerve to get that tone. You're squeezing the vestibular branch of the eighth cranial nerve. That's what gives you the dizziness and that sort of unreal feeling. But also, the skull is squeezing the spinal cord. Most people don't realize it, but your spinal cord is formed in the brain, comes to the back of the skull, and that big hole in the back of the skull, foramen magnum, which is Latin for big hole. And as you get osteoporosis of the skull, your skull goes from being a quarter of an inch thick to an inch thick. And all those tunnels that those nerves go through and the spinal cord goes through get filled up with this tendon-like material called bone matrix, and your spinal cord is being squeezed by your skull. So you weigh 100 and
about 75K.
Yeah, okay, 75K, so 160, 170 pounds kind of thing. I want you to have 2 healthy brain and heart packs per month, full dose everything twice a day. 2 healthy brain and heart packs per month, a full dose of breakfast and dinner.
Yeah.
I want you to get 2 bottles of our MSM, so you can take 3 with each meal. That's going to help rebuild the skull. Okay, open up those holes, take the pressure off your spinal cord and your eighth cranial nerves. You may also have other things. I mean, are you getting any loss of vision and you don't have glaucoma, you don't have pressure in your eye, you're not putting drops in your eye because you're slowly losing vision, or you're losing some vision?
I had a really bad burst blood vessel the other day, really bad, and a little bit of blurred vision, yeah.
Okay. And this could be called ONA, optic nerve atrophy, because the skull is squeezing that second cranial nerve, which is the optic nerve, goes from the brain through the skull to the back of the eye. You can lose your sense of smell, your sense of taste. You can get Bell's palsy, trigeminal neuralgia, and you get this spinal cord thing, okay? It can be called Erb's palsy when it gets really bad, ERB''S palsy, where you get numbness and tingling. It's almost like you're getting sciatica, which is a low back thing, and then down your legs and everything. You're going to get a sciatica-like thing in your hands and arms because your skull is squeezing your spinal cord. Okay. So you're kind of at the beginning of that. Okay. So the MSM. I also want you to get our vitamin D3 capsules. Take 3 of those twice a day so you can absorb the minerals and put them in the right place. I also want you to get our collagen. Okay. We have the glucogel, which is beef collagen, and we have the collagen peptides, which are a mix of fish, poultry, sheep, and beef. I take 2 servings of the glucogel a day, one at breakfast, one at dinner, and I take the collagen peptides for lunch myself. I weigh 142.
Yep.
And you don't have any history of any cancers or anything like that?
No.
Okay. If you want to speed up healing, you can take, let's see, we have things that actually make stem cells happy, okay? And these things that make the stem cells happy, you can take 3 doses of those twice a day. And I apologize, it's escaping me for the moment. We got 5,000 products. It'll come to me in a minute.
Actually, I just remembered I did get skin cancer once.
Okay, well, I won't tell you to take that one then, okay? I won't. Yeah, Immortalium is the name of it. Immortalium.
Oh, Immortalium, yeah.
Yeah, and it helps your stem cells regrow new cells. But if you have a history of some skin cancer, I would leave that one out. Okay? Yeah, don't take the Immortalium. And so that's where you start. And again, you got to get rid of all the bad foods so you can maximize absorption. And so, for the cost of a cup of coffee a day, you're going to add 25 to 50 very, very high and good quality life. Okay. So give us a call every couple of weeks because you're going to see results very quickly.
All right.
These things repair very quickly.
Thanks, Joel.
You bet. God bless.
Thank you. We've got a few minutes to go. Doug, if you want to give us a real quick question, then I'd like Ken Smith to take us to the end of the hour with Dr. Wallach. Doug, if you want to unmute yourself and ask your question, go ahead.
Thanks very much, Jamel. Thank you. Hi, Doc. How are you?
Okay. How can we help you?
And Dracy has an announcement too, but we'll do that at the end with Ken Smith. Go ahead, Doug.
Very quickly, Doc, I have problem with exostosis down on the lower right and right-hand side of the jaw as well as the left-hand side. I've looked at some of your earlier videos and the suggestion was...
Okay, I want you to okay, did you say you had osteoporosis or exostosis?
Exostosis.
Okay, which do you have any bone spurs and enlarged bones? And
it feels like it's enlarged bones just on the inside of the teeth, though. So I've had that now. It's not painful. I've had that now, sort of slowly coming and going, but more going now.
Okay. Now, do you have that? Do you have that going anyplace else? Do you have any knees that pop when you go up and downstairs?
No,
so you don't have any
not at all.
arthritis that you know of, okay? And
No,
are you losing any vision or ringing in the ears or anything like that?
The tinnitus I've had for a while, yes, and the eyes,
Okay.
I'm slowly knowing the vision in the eyes as well.
Okay, yeah, so that's ONA, optic nerve atrophy, because the skull is squeezing the optic nerves. It goes from the skull to or from the brain through the skull to the back of the eye. And also tinnitus has the auditory branch of the eighth cranial nerve being squeezed. And so you got a lot of things going on. What do you weigh? You look like a slim guy. What do you weigh?
Me, I'm 137 pounds, 5'7", Doc.
Okay, 137 pounds. I have you take one healthy brain and heart pack per month. Get another bottle of our selenium. One bottle of selenium comes with that. So once you get another bottle of our selenium, so you can take 3 of those twice a day. I also want you to take a half a dose of that healthy brain and heart pack twice a day. Okay. I want you to get our MSM. Take 1 bottle of MSM, so you can take 3 of those twice a day to rebuild the bone, cartilage, ligaments, tendons, connective tissue. And then that extra bone mass will shrink. Then I also want you to take the vitamin D3, 3 of those twice a day. That's 2 bottles a month. And the collagen, okay, the glucogel. You could take 5 of those twice a day. That'll be 2 bottles a month of the capsules. I would start there. And do you have any pain, or is it not really?
No, not normally, Doc. Sometimes when it sort of changes at 62 now, nearly 63, I'm sort of noticing the change with weather and things like that. So
okay, is that in your neck, in your back, or your shoulders, or where's the discomfort at?
In the neck around about C5 connection to T1, Doc.
Okay, so yeah, you want to put that CM cream and the trauma oil wherever the discomfort is. You'll get a couple of hours of relief, and you can do it, 3 times a day. So you want to time it so you get, whenever you need to be really comfortable, before you go to bed and when you first wake up in the morning, in the middle of the day, kind of thing, as opposed to just putting it on any time. And so, yeah, this goes away very quickly.
Yep, I'm sort of noticing a bit of help. I have.
Don't forget this one.
I have that already, Doc. Thank you.
Okay, good. So
Thank you.
Thank you very much. We've got a couple of minutes to go. Dracy and Ken. Dracy, if you want to do an announcement, and Ken, if you want to take us out, that'd be great. Go ahead, Dracy.
Thank you so much. First of all, I really want to highlight and congratulate Ken and Jamel and Dr. Wallach for 12 weeks in a row of doing these calls. The difference you are making is outstanding, and we just want to say a big thank you. That's why I wanted to highlight that. The other thing I wanted to say, for those in the field, that when you recommend the MSN, that I know Dr. Wallach has highly recommended, since we don't have MSN down under, that you've recommended ProJoint FX as an alternative.
That's correct.
I want you guys to know that we have been doing our investigation of being able to bring MSN down under. And so we have it in the hands of the people who approve it. There seems to be one ingredient that we just got to get how much of a dosage of it is. If we can pass that, we will be able to bring that down under. I just want you to know that we're working on that.
Yeah, well, the ProJoint FX is a good beginning. Absolutely.
Yeah. And the other good news I wanted to announce to everybody today is that we officially, you guys are the first to know that collagen peptides and collagen creamers are now in our warehouse.
Yes.
Down under, but the good news is you guys are the first to know. I haven't announced it to the field because we're just waiting for it to be in the system. So you guys go and keep checking each day. And you can be the first to purchase it, and then I will announce it to the field. So you want to get in quickly. We will be limited stocks, but you guys have the first to know about it, and I will definitely announce it to the field when it's out there, but you can keep checking because you'll find out soon, okay? So that's the awesome news on that. And other than that, I just wanted to say, everybody on this call, keep sharing and growing. This is the best thing you can do for you and your business and to those that you love. So thank you, Doc. We really appreciate all that you do.
Oh, thank you. We appreciate all you guys do. Thank you.
Thank you very much. We're at the end of the call. Ken, if you want to say a quick anything, Doc, and go ahead.
I want to obviously thank Doc. Doc is a miracle man, although he's very humble about it all. And you putting this together, and of course the lovely Dracy coming on board and being able to share, some hidden secrets, if you like. And I know she's down here doing everything she can to help us forward and get the products and things the way we want them. And thanks again, Dracy, for all of that. And thanks, Jamel. And Doc, same place, same time, same bat channel next week.
Yeah, you got it. God bless and good day, mate.
Thank you very much. Yeah, thank you. See you next
Good
week.
day, mate.
All unmute yourself and say aloha, goodbye to Dr. Wallach. Until next week. Thank you very much.
See you later, Doc.
Bye.
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 Bye. Bye.
Bye, everybody. Thank you.